Okay, so hearing the words radiation therapy for yourself or someone you love, well, that can be a lot to take in. It's totally natural to have questions, and maybe a little bit of anxiety too. So in this explainer, we're going to break it all down, what modern radiation therapy really is, how it works, and what you can expect. Let's get right into it.
So let's start with the biggest question of all. When your doctor says radiation, what are we actually talking about here? Is it some sci-fi comic book stuff? Well, the reality is much, much more controlled and actually way more common than you might think.
For most people, the answer is something called external beam radiation therapy, or EBRT for short. What it boils down to is this. It's a treatment that uses a very sophisticated machine to send invisible, high-energy beams from outside your body to a very specific target inside your body. It's all external, it's incredibly targeted, and it's really the cornerstone of modern radiation treatment. Now I want you to really lock in on these 5 points because they're so important for getting past any old myths you might have heard. Today's radiation is painless, and I mean you literally don't feel a thing. It is unbelievably precise, all planned out with advanced scans. It's non-invasive, so no cutting or surgery. It's safe, you are not radioactive afterward. And it's proven, with decades and decades of solid research behind it.
Okay, so with that foundation set, let's get a bit more specific. What is this tool actually used for?
EBRT is this amazingly versatile tool. Its main job, of course, is treating cancer, whether the goal is to cure it completely, shrink a tumor down before surgery, or just keep it under control. But it's also used for certain benign, that is, non-cancerous conditions. And this is critical. It can be used just for symptom relief, to ease pain or pressure, and seriously improve a person's quality of life.
All right, so that's the one. But what about the how? What's it actually like to go in for a treatment session? Let's walk through what a typical day looks like.
Honestly, most people are surprised by just how normal and routine it all feels. It's a really predictable 4-step process. First, you'll arrive and check in. Simple enough. Then, the team will get you into the exact same position every single time, using these custom supports made just for you, like a molded pillow or a mask. Step 3 is key. They take quick scans to make sure you're lined up perfectly. And then it's the treatment itself, where the machine just quietly moves around you.
And get this. This is the part that surprises pretty much everyone. The whole appointment, from start to finish, might take, 10, maybe 20 minutes because of all that careful positioning. But the actual radiation, the time the beam is on, that's usually just 1 to 2 minutes. That's it.
And because it's so quick and non-invasive, you can see how most people can just fit it right into their daily lives. The whole goal is to cause as little disruption as possible so you can keep on doing the things that matter to you. Driving, working, spending time with family, all while you're getting treatment.
Now, it's really important to know that EBRT isn't a one-size-fits-all thing. A much better way to think about it is like a high-tech toolkit with all these different techniques that can be picked and chosen to create a plan that's personalized just for you.
So here's the deal. The treatment is totally tailored to you. For a simpler, well-defined tumor, a technique called 3D CRT might be perfect. But what if a tumor is wrapped around something really sensitive, like your spinal cord? Well, that's when a more advanced technique like IMRT comes in. It can actually change the beam's strength as it moves, kind of like painting the dose exactly where it needs to go while shielding what's nearby. And for really small, specific targets, SBRT is like a surgical strike, delivering a super high, focused dose in just a handful of sessions.
And to make sure that precision is absolutely spot on every single day, we have these incredible guidance systems. You can think of IGRT as a quick GPS check right before the treatment starts, using scans to adjust for any tiny shifts in your body from day to day. MRI-guided RT takes that a step further. It's like having a live video feed during the treatment so it can adapt to things like your breathing in real time. It's all about hitting the target and only the target.
The toolkit doesn't just have different techniques, it also has different types of beams. Most treatments use X-rays, which are super versatile, but some cases call for protons. See, protons have this unique physical property. They travel to a specific depth, drop off all their energy, and then just stop. They don't go any further. This means they deliver almost no radiation dose to the healthy tissue behind the tumor, which can be a massive advantage, especially for kids or for tumors near really critical parts of the body.
All right, we've talked a lot about the technology. But now let's get into the stuff that's probably really on your mind, the practical, personal questions and concerns that just about everyone has.
Okay, side effects. Here is the single most important thing to remember. They are local. Radiation only affects the area it's aimed at. So if you're getting treatment to your leg, you're not going to lose the hair on your head. The most common effects are some fatigue and maybe some skin irritation, kind of like a sunburn, right in the treatment area. And your care team is with you the whole way with all sorts of strategies to help you manage and minimize any discomfort.
Now for the two questions that are likely at the very top of your list. The first one is probably the most immediate. You're on the table, this big machine is moving around you, so does it hurt?
And the answer, thankfully, is just a simple, straightforward no. You can't see the beams, you can't hear them, and you absolutely cannot feel them. It feels exactly like getting a regular X-ray, which is to say, it feels like nothing at all.
And that usually brings up the next big question. Once the machine is off, does that radiation stay with you? Are you radioactive? Is it safe to be around your family, your kids, your pets?
Absolutely not. With external beam radiation, the energy passes through your body, it doesn't stay inside. The moment that machine turns off, the radiation is gone, period. You can go and hug your loved ones immediately with zero risk to anyone around you. And really, that's what it all boils down to. This is the core philosophy of everything we've talked about. Every single decision, from the technique that's chosen to the type of beam they use, it's all about finding that perfect balance, being as tough as possible on the tumor while being as gentle as possible on the rest of you. So when you think about how far this technology has come, from relatively simple beams to MRI-guided real-time adaptive therapy, it really makes you wonder, right? As these tools get even smarter, even more precise, what's the next frontier going to look like? What new possibilities will open up for treating disease without ever needing to make a single incision?